So again, when we talk about the health insurance, we're looking at the eligibility requirements. It varies with age, marital status, dependency. Who's assigned the benefits? Who does it go to? Does the insurer pay the doctor, or does it pay the hospital directly? Internal limits, fixed amount paid per day for a hospital stay. So the co-payment, that's the cost sharing portion that, such as for $20 or $30 per doctor visit going to the office. Service benefit entitles the specific care rather than a fixed dollar amount per procedure. Benefit limits maximum number of days in the hospital. There would be exclusions, limitations, coordination of benefits. Again, if you've got additional coverage so that it's no more than 100%. This is often the case when we have when we have health insurance and coordinated benefit with your automobile insurance, for example, making sure that the physician or whomever is not going to be paid in excess of what would the 100% amount that would be paid to them anyway. So coverage under more than one, that's again coverage under more than one policy, guaranteed renewability, cancellation and termination explains the circumstances wherein your policy can be canceled, or it can be terminated. So trade-offs, reimbursement versus indemnity, meaning that you pay up out of pocket and then you're reimbursed for it. The indemnity, it goes directly to the doctor in this case. Internal limits versus aggregate limits, deductibles and co-insurance, as we've already kind of described. Out-of-pocket limit in total for your annual for a year, for example, and the benefits are based on reasonable and customary charges. These are numbers, these are payments that are negotiated by the insurance company, how much they're willing to pay for a service, for example. And that again determines whether if you're in network or out of network, and we'll talk about that going forward. So evaluating private health insurance and healthcare, which coverage to get for medical insurance, you've got three choices: basic, major medical, or both basic and major medical. So again, depends upon how comprehensive that you want that coverage to be. So private insurance companies, you have individual policies as opposed to group policies that are sold to an employer. Hospital medical service plans. So for example, Blue Cross and Blue Shield. Blue Cross, part of the Blue Cross umbrella, Blue Cross Blue Shield umbrella, covers hospital care, versus the Blue Shield covers surgical and medical services. So hospital stay on the Blue Cross side, and for the surgery and for your physician compensation, for doctor visits, etc., that would be on the Blue Shield side. So drilling down on the different types of insurance, again, the health maintenance organization, this is managed care. So you're prepaid for your comprehensive health care, to members. So it's best known as HMOs and also PPOs, but the HMO is the one we're focusing on, where you have a primary care physician or a PCP, and they're the ones that direct traffic. They're the ones that tell you if and when you can go to a different provider, if you're going to go to see a specialist, etc. You're kind of limited, and they're the ones that direct you to those specialists. And there's a fixed, again, prepaid monthly premium that would be associated with it, and focus on preventive care, along with the basic and supplemental services that would go along with it. Next would be the PPO, which gives you a little bit more latitude, where you have it's a preferred provider organization, where you have several providers to choose from. It costs a bit more than HMO, but you're directed toward physicians, toward medical personnel that are within that network, if you will. If you go outside of the network, you end up paying more. This includes, again, EPOs and POS plans, point of service. Anyhow, other options, home health care agencies, Visiting Angels, etc., those type of organizations, employer self-funded health plans where they actually cover the cost. It's not going through a third party. Through the insurance companies may manage the plans, but all the costs are paid for by the company itself. New healthcare accounts, such things as health savings accounts, health reimbursements accounts, and flexible spending accounts. These are tax advantageous plans where you either have no taxes involved, or where there are a variety of things that come, but again, it's mostly aiming at reducing the tax burden using non-tax dollars, etc. Okay? So moving away from the private healthcare to government healthcare, and there are two basic programs. One is Medicare and the other is Medicaid. Medicare is for those folks who are 65 years of older, and certain disabled people would also fit into that criteria. And there are different parts that are involved. Part A, that's the hospital insurance part. So that would be for inpatient hospital care or inpatient skilled nursing facilities, home health care, hospice care. Part B, that would be the medical insurance, and that's voluntary in terms of doctor services not covered by Part A. Part C would be Medicare Advantage Plan. Part D would be the Medicare prescription drug benefit. Medigap or MedSup insurance, they may pay what Medicare doesn't. So again, when we're talking about the Medicare Advantage, we're going above and beyond, trying to get additional coverage beyond just your straight Medicare coverage. Medicaid is for low-income individuals and families, and it's administered through the state via block grants coming from the federal government. So Patient Protection and Affordable Care Act of 2010, or Obamacare, offers tax credits for small businesses to make coverage more affordable, prohibits denying coverage to children with pre-existing conditions, bans insurance companies from dropping sick people, eliminates co-payment for preventive services, annual physicals, and so on and so forth. Allows children up to age 80 or 26 to 86 to remain on parents' plans. Prohibits lifetime caps on coverage, restricts the use of annual limits, provides just a whole slew of things, and it expands also this Medicaid program for low-income individuals, and employers with 20 or more employees must provide insurance. So there are different stipulations, and it's adding cost, but it also increases the availability, or increases the amount of coverage that is out there available for people, making it, again, as implied, the Affordable Care Act, which in some cases is not quite that affordable. It can get kind of pricey as well. At any rate, so again, the individual shared responsibility provision requires you and each member of the family to have minimum health care coverage every month, or have an exemption from the responsibility to have that minimum essential coverage, or it makes shared responsibility payment when you file your federal income tax return. Starting in 2019, the TCJA and ACA individual mandate that required all Americans under 65 to have some sort of health insurance or pay an annual penalty of $6.95 per person. That has been waived, by the way, or was waived. The health insurance marketplace, where you can go out there and get the Obamacare, etc. The bronze plan, the silver plans, the gold plans, platinum plans, and priced accordingly. So compare plans and enroll in a health plan, and there have been measures to curb the waste and fraud and so on and so forth, and it's met with kind of dubious at best, but things are changing as well. You should be aware of. So establish there are new tough requirements for healthcare providers that wish to participate in Medicare and Medicaid program in general. Again, this goes back quite a ways. So disability insurance, this is the last piece that we'll be talking about here. Disability insurance means that the insurance rather protects your most valuable asset, your ability to go out there and earn an income. Disability is more likely than death at any age, meaning where you may get into an accident where you cannot do your job anymore. So it provides some sort of cash income lost as a result of accident or illness. If you become disabled, your income drops, but your medical expenses continue to go onward, and typically they go higher, right? So this is where that disability insurance comes into play. Some policies define it as simply as an inability to do your regular work, but it can go on to different there are different criteria that, if you will, to qualify for disability in the within the private sector, this private disability insurance, through your employer, etc. How long that disability lasts, that again coming from your employer or through government. So the sources, gets at the sources of that disability. Your employer, group disability plans, maybe short or long term. Again, most insurers limit benefits from all sources to be no more than 70 or 80% of your take-home pay. And Social Security also kicks in, covers total disability that lasts more than 12 months, and you must be unable to do any work at all. Workers' compensation is also part of the piece of the puzzle, so it applies if your accident or illness occurred at your place of work or resulted from your type of employment. It was on the job, something that happened as a result of your job. That's where workers' comp would kick in to cover that disability piece.